And good morning, everyone. Welcome in to a brand new edition of Sports Medicine Weekly on this Sunday morning, first Sunday in October. My name is Steve Cashel. So happy to be joined by my co-host. He is Dr. Brian Cole, the head team physician for the Chicago Bulls, one of the team physicians for the Chicago White Sox. He's a sports medicine specialist and one of the renowned orthopedic surgeons around the world from Midwest Orthopedics at Rush. Our producer is Shane Reardon. Our website is sportsmedicineweekly.com. You got a lot of great information off the website. And as a reminder, podcast segments always available to hear on our Sports Medicine Weekly blog, also through Apple, Google, Spotify, Pandora, YouTube, and iHeartRadio. Dr. Cole, how are you on this Sunday morning?
Feeling like fall, Steve. Doing great.
Okay, yeah, a little chill in the air. Obviously, this weekend's going to get warmer. Next week, I'm hoping to get my maybe my final rounds of golf in the next 2 weeks. Looking forward to it. But, hey, I want to start with this, Dr. Cole. NFL Players Association President J.C. Tretter calling for NFL teams to change all field surfaces to natural grass to reduce the risk of injury to players. Currently, 13 NFL stadiums use artificial turf. And, from what I've understood, the natural grass is getting maybe softer. They're trying to neutralize it a little better. But, I guess the injuries are still there with people and these NFL players, probably more lower body injuries getting hurt on the field turf.
This is an ongoing dialogue. It's been going on as long as I can remember. When you take into consideration that 85% of ACL injuries are non-contact, which means that they're not hitting another player, but they're associated with direction change. And one of the things that's fascinating about an ACL injury is that it's something where there's a disconnect between the brain and the knee. It could be just a millisecond that the brain doesn't lead to contracting the proper muscle groups to prevent injury. And the several things have been targeted, not just things that are specific to the athlete that might put an athlete at risk, for example, just because of their physical conditioning or body habitus. But there's some other things, Steve, that have been looked at for years, and that's the nature of shoes, shoe wear, the grip, the spikes, and so forth. And then the ongoing battle is this grass versus turf. And it's not, as you alluded to, the grass is changing and so forth. It's not just any grass. There could be 5 different types that are contemplated, and then it comes to turf where there's several different types, and this is big business, as you can imagine. But the general belief is that turf injuries compared to grass may have a significant increase in injuries that might otherwise be avoided in a setting where grass could be used. So I think it's a worthy discussion. We're always looking for ways to modify, injury rates. I think prevention is where it's at. And the good news is that while J.C. Tretter, the president of the Players Association, is calling for this, he can rely on a body of science that can let very smart people who are plugged into this help them make a decision and do it in an evidence-based way, because there is a ton of science in this area.
And Dr. Cole, what are you seeing with your patients? Have you seen, whether it's the youth player, the high school player, the college player, even the NFL player that you've worked on and done surgeries on, come in and talk about maybe have suffered a lower body injury due to an artificial surface?
Steve, other than when it's wet and it's a slippery factor that might be unique to one surface versus another, they're usually not coming in blaming the turf or the grass, but I think it speaks to the fact that we can't have tunnel vision. When we look at injury, it's really easy to think very linearly, to say that if this, then that, and that's why it happened. The challenge is that that's a very sort of myopic, a nearsighted way to look at it, because there's so many factors that lead to injury. And but you have to contemplate them all. So as I mentioned, there's athlete specific, there's shoes, there's strength conditioning, there's things that you can't modify, and there's the things you can modify. And I think it's almost like you could almost put a relative weight to all these factors to say if this then that. But you got to look at it as an equation that involves all these variables, not just one thing or the other. So I think it's tough for an athlete to generally assign it to say, yep, that was turf, wouldn't have happened when it was on grass. But there is some science here that suggests that non-contact injuries in certain types of turf environments can be at a higher incidence compared to those that happen on grass.